Hi, my name is Jessica Cabral. I am in the Indiana State University Distance Online BSN RN program. This presentation is for my community health nursing class. Today I'll be talking about influenza, aka flu. Before we begin, I'd like to just pause for a brief moment. And if you could, please click on the link in the description for a short questionnaire. By the end of this presentation, the hope is that you take with you information regarding signs and symptoms of the flu, how it is diagnosed, how it is spread, how to prevent, what type of treatments are available at this time, and finally, what the different types of seasonal variants there are. Let me talk a little bit about the signs and symptoms to look for. The flu is a contagious respiratory illness caused by influenza viruses. It can cause mild to severe illness and at times can lead to death. Symptoms of the flu include fever. It's usually high in the range of 102 to 104. A headache, extreme tiredness or fatigue, a dry cough, sometimes moderate or severe, a sore throat, runny or stuffy nose, and some muscle aches. Sometimes you might have some stomach symptoms, such as nausea, vomiting, and diarrhea that can occur, but are more common in children than adults. The CDC recommends that people stay at home for 24 hours at least after their fever is gone, except to get medical care or other necessities. The fever should also be without medication. Here, we're going to highlight a couple of the differences between the cold and the flu symptoms. With the cold, the fever is rare. So if you have a fever, it's probably the flu. If you're comparing between is it a cold or a fever? The cold or the flu. The onset of symptoms are generally gradual when it's a cold, but very sudden, insipidus with the flu. Sometimes you might get a sore throat with the flu, but it's more common in a cold. A headache is very uncommon with a cold. That's usually with the flu. And the cough is the biggest difference here. With a cold, you're going to have a hacking, wet, productive cough that's going to be mild to moderate, and then with the flu you're going to have more of a dry cough that's going to be more moderate to severe. So there's going to be the cough, but what it sounds like and it's wet or dry is going to be the biggest difference. Flu and the viruses, I'm going to just highlight a couple of similarities between the flu and what COVID is. Since they're both viral respiratory infections, they're going to have some symptoms that are similar. They're both transmitted by respiratory droplets from an infected person. Both cause fever, cough, and fatigue. And guess what? Lo and behold, they're both preventable with the vaccine. Get your shots. They're free and available whenever, wherever. Talk to your doctor if you have any questions. The most common types of ways that we can diagnose the flu are going to be either through a nasal or throat swab. You can have this done in a doctor's office or in immediate or urgent care. The most common is called a rapid influenza diagnostic test. These tests can generally provide results 10 to 15 minutes, but they're not as accurate as the other, which is a rapid molecular assay, which detects genetic material of the flu virus. They generally produce results in 15 to 20 minutes, and they're definitely more accurate than the RIDTs or the rapid influenza. How it spreads. The seasonal influenza spreads really easily, especially in crowded areas, including schools and nursing homes. When an infected person coughs or sneezes, droplets containing the virus are coughed into the air and can spread up to 1 meter and infect people that are close proximity. The flu can also be spread by contaminated hands. So to prevent this, you want to wash your hands, cover your mouth and your nose when you're coughing or sneezing. The incubation time from infection to illness is about 2 days, but can range anywhere. The CDC recommends yearly flu vaccine as the first and most important step in protecting against the flu. Everyone 6 months and older should get an annual flu vaccine. Children younger than 6 months are at higher risk of serious flu illness, but they're too young to be vaccinated, so people who are caring for these infants should be vaccinated instead. Avoid close contact with people who are sick. This is how we can best prevent this. If you're sick, stay home. Limit your contact with other people as much as possible. Cover your nose and your mouth while you're sneezing or coughing with a tissue. Then throw it in the trash. Then wash your hands with soap and water. If soap and water are not available, please try to use an alcohol-based sanitizer. Avoid touching your eyes, your nose, and your mouth because we all easily. If you happen to get the flu, there are some treatment options. As an option for a second line of defense, it's called an antiviral drug. There's 3 different types. Just kind of depends on what your healthcare provider recommends for you. They are not a substitute for vaccination. The antiviral drugs do differ in terms of who can take them, how they're given, what their dose is, because it depends on your age and if you have any medical conditions and the side effects. So make sure you talk to your doctor about further information if this is a treatment option for you. And if you do happen to get these, they're best if started within 2 days. The seasonal variants. Influenza viruses are divided into 3 types, A, B, and C. A and B are responsible for epidemics of respiratory illnesses that occur almost every winter, often associated with increased rates of hospitalization and death. Type C, we don't really hear about this and we don't really test for it because it usually causes a very mild or respiratory symptom, illness symptoms, or nothing at all. It doesn't cause epidemics and doesn't have the impact or the severity that A and B. All right, for more sources of information, I've listed some websites: the CDC, IDPH, the WHO, and Red Cross, especially now that we need more blood donated because things are happening. If you get the flu vaccine, it does not mean that you cannot donate blood. Absolutely, please do if you are able to. Even part our ways again. Pause, click on the link in the description for a short questionnaire. Thanks for stopping in.